Older adults are the backbone of the community, and while some are healthy and active, many could be at a serious point in their lives where mental health conditions happen. In my Closing the Gap segment, I explore the mental health of older adults and what can be done to help those in need who suffer due to their zip code. Here's a staggering statistic. Nearly 15% of adults 60 and over in the U.S. live with some type of mental illness, and many times it goes untreated, so it gets worse and worse and worse. Here to talk about seniors dealing with mental illness and what could be done to help is Christiane Williams with Leading by Example. How are you?
Thank you for having me.
Before we talk about these statistics, first give me some background about yourself.
Well, I am a mental health awareness trainer and a consultant. I do mental health awareness training all over the United States, or a national trainer.
And talk about some of the common mental health conditions in older adults.
One of the biggest one is depression.
Really? Why do you think so?
Because they become lonely, hopeless, and you think about someone that has always been a mover, you know, as they call me, a busybody. Mm-hmm. And then all of a sudden, as we start to age or something happened to us physically, you know, and we can't do what we used to do.
And many seniors are dealing with mental illnesses, but they have no idea that it's a mental illness. So what can be done? What are some signs that they can look out for, or a family member or a caregiver can look out for?
A change in sleeping pattern, appetite, irritability, you know, just wandering off is one of the main things. I'll tell everybody, document it. Different things that they're doing. So if you do take them into the medical provider, you can let the medical provider know, these are some of the things I've noticed with my loved one. I'm concerned. That's the biggest thing. I always tell people, document, because we could easily forget, but if you start documenting, I would say within a week's time, you would know if it's time to start getting medical care.
Yeah, and I was reading that loneliness and social isolation early in life sometimes leads to mental illness later in life. Expound on that.
It does. When we don't socially engage with people, as we progressively get older, we just isolate more and more, until the point where we actually just sitting there looking at four walls by ourselves. The friends are not there, the family start to deteriorate, you know, we're just not socially involved.
And some people don't know that other common conditions include dementia or memory issues. Kind of talk about that, because that affects a lot of seniors.
It does, and dementia, you know, is not reversible. That's something, and you know, as loved ones, we have to sit and actually look at our family members deteriorate before our eyes. So the person is not cognitive of what sometimes they're saying, they're doing, you know, walking away from home. That's why we have to make sure we put some protective factors in place for them. Once we find out they have been diagnosed, start going to the doctor with them. Mm-hmm. You know, you want to find out what is the doctor telling that person that's going, instead of they're relaying the messages back to us.
And I'm glad that you said that. I'm going to read some of the common conditions. Memory issues, as I just said, dementia, including Alzheimer's disease, Parkinson's disease, depression, and bipolar disorder. How do you know that you suffer from these conditions? And is there a way to avoid this later on in life?
They always tell you have a healthy lifestyle, eating, exercising, but even with that, we still could get those diagnoses, just part of aging. It's the aging process. There's some of the things that, you know, we can't avoid. It's just some things that's going to happen to us. You know, sometimes we wonder why this happened to me or why this happened to my loved one, but it's just part of the aging process. We just got to make sure that we know what resources are available for us in this community.
And let's talk about some of those resources. Talk about the resources that are available for seniors.
One of the best one I've actually had the privilege of visiting, one of the local adult daycare right here in the Clinton area, is one of the best I've seen. And the people there really take care of them. They're making sure they're not wandering off. The social skills that we was talking about, they're not isolated. They're there with other people, and they engage in activity, games. We started what we call a senior saint ministry at our church, where 2 Tuesdays out of the month, they get together. They play games, they exercise, of course they eat, and just be sociable with one another.
Those seniors who live in rural areas, sometimes the resources are not available for them. What can be done to help close that gap?
I would say find out your local community human service resource center in that area. Most of them have like senior care where they would pick them up. The transportation in that county would pick them up and bring them to like the day centers, the senior day centers throughout the rural areas in the county. Most of them have that. I know I've seen them that, bring them to doctor's appointments. So, just utilizing the resources, calling your local officials and find out what daily routines or resources you have for adults.
Coming up this month, there is a mental health fair that will help seniors and anyone dealing with mental health issues get the resources and learn about the resources that are available.
Yes, on Saturday, March the 26th from 9 to 1 at College Hill Missionary Baptist Church. We will be hosting with St. James Missionary Baptist Church. We're collaborating with them in hosting our mental health fair. This is the first year we're collaborating with another church to bring in vendors. It's mind, body, and soul, and we're doing it all. We got the massage chair, we got therapists, we got even the people from the adult daycare. They will be there. Any type of mental health services that's available, we have intentionally went out and tried to have those vendors there, from children up to senior adults.
Why is it so important not to forget about seniors?
Because the seniors are why we are here. It is important to provide them with a quality of life, a life that is enjoyable, comfortable, as they progress through their senior years. We didn't know, or we don't know what ailments we may have or they have encountered, so we got to make sure we stay abreast on the resources that's available.
And especially those seniors with mental illnesses, right?
Absolutely. We got to make sure and what services are available, what could be done to help them, doing anything that we can to make their lives comfortable. A lot of times just a simple going over and sitting down and having a conversation, or just making a routine with them could be the difference between life and death.
Thank you for joining me.
Thank you for having me.